Welcome, everyone. Thank you so much for joining. Today, we're going to be focusing on the impact of AI on fairness and equity dilemma. This presentation is brought to you from the CEnR Team, the Community Health Equity and Engagement in Research team. I'm joined by my wonderful colleagues, Paula Moody and Jess Abram-Schroedel. And I'm delighted to introduce two of our guest speakers today. We have joining us Dr. Ani Daniel, who's Vice President of Data and Analytics Strategy at Highmark Health. Ani has fantastic expertise in the space of AI and health equity. She's accountable for internal and external strategic partnerships. And she also is accountable for the data AI ethics strategy and operationalization, embedding data AI ethics, machine learning operations, and responsible AI throughout the end-to-end initiative and data life cycles. She's passionate about the application of data analytics to drive evidence-based health outcome improvements to address health equities. We're also joined by Dr. Jen McCormick, who's Associate Professor in the Department of Humanities, and she's also our co-lead for the Research Methods and Ethics Core in the Penn State CTSI. We'll be adding their bios to the chat so you can learn a little bit more about our fabulous expertise today. We're just going to go over some session logistics. This presentation is being recorded. Please feel free to raise your hand to ask questions. We want to make sure this is engaging as possible. And feel free to use the chat feature to make comments, share resources, and also make connections with fellow colleagues. Presentation materials, as always, will be shared post-session along with the session recording. Please do make sure that your name appears accurately in your Zoom box. And live transcription is available if you need that. For the agenda today, we're going to be talking about AI and health equity. We're going to explore the contextual background of AI and health equity and the interface in the healthcare and research spaces. Then we're going to focus a little bit on the ethical implications in research. We'll engage in a group think tank, and then we'll close with Q&A and resources. Our learning objectives today are to engage in an ethical dive into the power and pitfalls of AI and its intersection with healthcare and research. And then we're really going to hone in on the downstream impacts of underrepresented populations and how this equitable lens is critical to AI implementation to reduce these unintended consequences. So let's get started by taking a contextual exploration into AI and health equity. Rooted in the simulation of human intelligence by computer systems and machines, AI has the potential to really transform how humans learn, work, and interact with one another in everyday aspects of life. And it's also really quite primed to revolutionize healthcare. So when we think of how AI plays a role in healthcare, it's really divided into these categories: patient-facing, telehealth, research, and doctor-facing. It's really rapidly transforming the healthcare industry, but we really have to be vigilant in order to ensure that these technological advancements bring equitable outcomes. There are a lot of success stories in AI already that I'm going to put up here, such as facilitating early detection of disease, driving drug discovery, enabling more targeted clinical trial recruitment, ensuring treatments can reach patients, and assisting in the operating room for efficiency and physician learning. AI is enabling researchers to develop more targeted medicines, drive progress towards precision medicine. Traditionally, AI discovering and developing new drugs to treat disease is a long and complex process, but AI is really primed to really accelerate drug discovery and implementation. So it's well positioned to help us address some of the healthcare disparities that exist. But with that comes some concerns. We're going to play this video, and I'm going to stop share for a minute so I can optimize sound. And I want you to notice not only what the video is saying, but also the machine learning that was used to make this video.
Welcome back to our channel, where we dive deep into the world of technology and its impact on various industries. Today, we have a thought-provoking topic for you, exploring the pros and cons of AI in healthcare. Artificial intelligence has been making significant strides in revolutionizing the healthcare sector. But like any technology, it comes with its own set of advantages and challenges. In this video, we will explore the potential benefits and drawbacks of AI implementation in healthcare. So let's get started. Number 1, improved diagnosis and treatment. One of the most significant advantages of AI in healthcare is its ability to improve diagnosis and treatment. AI algorithms can analyze vast amounts of patient data, including medical records, imaging scans, and genetic information, to identify patterns and potential risk factors. This enables earlier and more accurate diagnosis, leading to timely interventions and better patient outcomes. Number 2, data privacy and security concerns. However, with the immense amount of data being processed, data privacy and security become critical concerns. Healthcare systems store sensitive patient information, and any breach could lead to severe consequences. Safeguarding patient data from cyber attacks and ensuring strict compliance with data protection regulations is essential when implementing AI in healthcare. Number 3, personalized medicine. AI facilitates personalized medicine by tailoring treatment plans to individual patients based on their unique characteristics. By considering genetic makeup, lifestyle choices, and medical history, AI can recommend the most effective and customized treatments, leading to better therapeutic outcomes and reduced side effects. Number 4, lack of human touch. Despite its capabilities, AI lacks the human touch that patients often seek in healthcare interactions. Some individuals may prefer the empathy and understanding that only human healthcare professionals can provide. Balancing the use of AI with maintaining human-centered care is essential to ensure patients feel heard and supported throughout their healthcare journey. Number 5, enhanced medical research. AI is a game changer in medical research. It can process massive data sets and identify patterns that might otherwise go unnoticed by human researchers. AI-driven research accelerates drug discovery, aids in identifying new treatment options, and contributes to a deeper understanding of diseases and their underlying mechanisms. Number 6, bias and fairness concerns. AI systems heavily rely on the data they are trained on. If the data is biased or limited, the AI models may inherit those biases, leading to potential disparities in healthcare outcomes for certain groups. Ensuring fairness and inclusivity in AI algorithms is vital to avoid exacerbating existing healthcare disparities. Number 7, streamlined administrative tasks. AI can streamline administrative tasks in healthcare facilities, such as appointment scheduling, billing, and record keeping. This efficiency allows healthcare professionals to focus more on patient care, ultimately enhancing the overall healthcare experience. Number 8, job displacement. While AI automation improves efficiency, it also raises concerns about potential job displacement for certain roles in healthcare. Administrative tasks that were once performed by humans may now be automated by AI, leading to a shift in the job market. Striking a balance between AI-driven automation and preserving human jobs is essential. Number 9, predictive analytics for early intervention. AI's predictive analytics can identify patients at high risk of developing certain conditions, enabling early intervention and preventive measures. By identifying risk factors in advance, healthcare providers can proactively manage chronic conditions and reduce the burden on emergency services. Number 10, reliance on AI technology. One concern is the over-reliance on AI technology. potentially leading to the complacency of healthcare professionals. Relying solely on AI for critical decisions without human oversight could pose risks and compromise patient safety. In conclusion, AI holds immense promise for transforming healthcare in remarkable ways. It offers improved diagnosis, personalized treatment, and accelerated medical research. However, we must also be mindful of the challenges it presents, including data privacy, bias, and job displacement. Striking the right balance between AI integration and human-centered care is crucial for maximizing the benefits of AI in healthcare while minimizing its potential drawbacks.
Okay. Feel free to add into the chat what you thought about that video, what it presented, the pitfalls of AI, but also the way in which the story was told through the machine learning. Now we're going to take a look at really focusing in on what today's discussion is about: health disparities and AI's downstream impacts on underrepresented populations. So as we head into the future of healthcare, which is rapidly evolving, thanks to remarkable progress in digital technologies and artificial intelligence, we really have to apply the lessons we've learned about health equity. As we all know, the healthcare industry has been fraught with inequities and barriers for underrepresented populations. This is depicting really some of the biases and how they seep into the data design and use of AI and the cascading impacts it has on discrimination. When health disparities are not considered during all stages of AI development and implementation, AI can actually perpetuate existing biases and inequalities within healthcare, and that often is going to disproportionately affect our marginalized communities. There's also a lack of diversity and representation within the teams that develop and deploy AI algorithms. And so this can further exacerbate those inherent biases in the data and then have subsequent exponential impacts on really expanding those disparities and gaps. This walks us through an equity analysis of how bias is introduced from the very beginning of conceptualization in the AI process all the way through monitoring. So you can see that at every step of the way within the design, development, and validation, all the way through to how AI projects are monitored, there is room for these inherent biases to seep through. So previously I presented some of the success stories of AI on health outcomes, but now we're going to briefly view cautionary tales. AI interacts with socioeconomic, gender, and ethnic health inequities on many different levels and can both increase or decrease these inequities, as we're seeing, depending on the application and implementation. Most of us on the call have heard of social determinants of health. These are ever present in society, and when a model is based on real-life data, it may reflect and potentially reinforce the effects of social determinants of health. So populations that have historically been marginalized and experienced barriers to care are often underrepresented in historical data sets, leading them to being negatively impacted when biased data and algorithms are deployed in real-world applications. And so you can see some of these pitfalls here. I'm now going to pass it on to Dr. Daniel, and she's going to talk a little bit more specifically about the unintended consequences on marginalized communities.
Yeah, thanks, Jennifer. I think the video was really, really great at explaining some of the transformative powers of what I prefer to call augmented intelligence, but AI, artificial intelligence, augmented intelligence in healthcare. And ultimately, I think in the healthcare space, we all have the same goals, the quintuple aim: improved health outcomes, reduce costs, reduce health inequities, improve provider experience, improve member experience or patient experience. And so really all of the AI should be, all initiatives should be geared towards enhancing or improving one or more or all of those outcomes. So it's really, when we think about the North Star for healthcare and how AI can assist and can transform, we kind of have a really well-canned kind of North Star that we've been operating under for a long time. And so I'm always excited about the opportunities to transform. When we look at things like scheduling, we look at things such as ambient intelligence and the opportunity to potentially reduce clinician or physician burnout by enhancing the ability to capture the interaction between the physician and the patient, as opposed to having the physician have to be staring at his or her computer while they're taking notes. And it just really takes away from that really human to human interaction that is so important in healthcare. And so the potential in that particular use case is just amazing. And we're just seeing a lot of good outcomes, at least from the earlier organizations that have adopted some form of ambient intelligence to kind of address that issue. We also see it in things like scheduling. I think there was an example in the video, scheduling for things like infusion chairs. Sometimes if someone is a no-show or if there are gaps, it can lead to inefficiencies, which ultimately are costly. And so being able to leverage AI to enhance scheduling for things like infusion chairs, MRIs, et cetera, is a huge deal. Even scheduling for clinical staff, nurses, nurse staffing incentives. So there's so many different ways that AI is beneficial and can really benefit and enhance our lives, especially in healthcare. But then again, there's always the risks. And one of the most critical risks that I see in how AI could adversely enhance or could adversely impact downstream or exacerbate health inequities and health disparities is that there hasn't been enough emphasis upstream. And so, I think a lot of organizations, for example, at Highmark, we've been doing AI for over 10 years. So AI itself is not new. I think with generative AI, it's become like the hype and all of the potential there, plus the new risks associated with generative AI, large language models, and different other modes of generative capabilities. There's just been so much excitement and even more potential for optimization, efficiency, improvement in healthcare, et cetera. There was just a lot of hype, but it wasn't really balanced in terms of the upstream implications for those downstream outcomes that we're targeting. And so what I like to emphasize is data inclusion. There are not a lot of organizations that I can think of, and I could be wrong, maybe others on the call have different experiences, but there are not a lot of organizations that I can think of that prior to 2023 were like, wow, we're just so happy about our data quality and governance. We're just so we've got this industry leading data governance and quality capability or function in our organization that's really airtight, or we're just so amazingly happy with our data inclusion. We've got data that's representative of our members or our patients or, our, for clinical trials, and we're just so satisfied with it. And we're going to shout it from the rooftops. That's not something that I ever heard. And in fact, it usually was the opposite. There was usually a lot of griping, complaining, a lot of lack of investment in data governance and data quality, just because there were more shiny things to focus on, like modern, platform modernization, moving assets into the cloud computing, data movement, things like that were just more shiny and more received more attention from an investment standpoint from organizations. And so data governance and quality is kind of old hat. It's like, well, if you have something, the bare minimum in place, generally organizations are okay with that. And so, with this onset of generative AI, the emphasis on the need for high quality data and robust data governance upstream is now starting to catch up to the hype around the downstream implications for for how we use AI in healthcare and in all industries, really. And now there's a little bit of like slowing down to say, oh, well, ultimately, if you build a machine learning model, if you build an algorithm, there's very little, like if you have the expertise, then you can build an algorithm, you can build a machine learning model, you can tune it, you can, get the features right, get the weighting right, and you'll get something, right? But there's not a lot that you can do when your incoming data, the data that's used to build it, is biased, as was mentioned earlier from the beginning, because you can't necessarily manufacture that data. I mean, now there are conversations around synthetic data, but like truly today, if your incoming data is biased, if your incoming data is not inclusive of the different represented groups, which is historically what has been the case, then you're not going to, then we really should tamp down the excitement on the downstream outputs, because there are significant issues upstream that kind of addressing for bias statistically on the back end may not fix. And so my big push is that organizations really need to look upstream and invest heavily in the data governance and quality that was previously not well invested in, and also in data inclusion and data collection. And that is especially important for clinical trials, clinical research, et cetera. And it's also contextual, right? What we talk about here may not be the same as, how we discuss this in other countries. So each geographic, or other geographical location, there's a bit of context necessary to make sure that you're being, that we're applying the rigorous standards around data inclusion, data collection, and upstream data quality and governance within the context of that geographical location and some cultural context, and applying that all the way through to make sure that we are not exacerbating the existing healthcare disparities and health inequities. Because ultimately, the folks that are going to be most adversely impacted are the folks that are already experiencing the health inequities the worst, the folks that are not necessarily getting solid access to different interventions because of, access, transportation, some of the social determinants that were already mentioned. And so that's where I kind of tend to skew more towards the cautionary, like let's really make sure that upstream we have a robust mechanism in place so that we can be confident and, quite frankly, happy with downstream outputs that are produced.
Thank you so much, Dr. Daniel, for your infinite expertise in that space. And that is going to tee us up beautifully for our next deep dive into the ethical implications and regulatory compass through the research lens. And I'll pass it now to Dr. McCormick.
Thank you, Jen. And yes, thank you, Dr. Daniel. So the ethical and social considerations, the video really did a lovely job. And actually, Dr. Daniel touched on some of them as well, but just quickly, some of these I would consider bread and butter ethical and social considerations of just generally research ethics overall. So next, please. These include privacy and informed consent. I think, we touched on the privacy already, but informed consent, what's interesting about that is some of the data sets that AI is being trained on include those that are not necessarily protected by the IRB, things from like Facebook and other social media sites. And so, when those are in the public domain, but when people post things, they're probably not imagining those data being used for research. So it does beg the question, where and whether there is some type of informed consent that needs to be implemented. And taking that a step further, it kind of goes into this notion of governance that Dr. Daniel so lovely talked about. Governance in terms of who decides what data are being used and how that data are being used. We've talked a little bit about the lack of diverse training sets, and how that can lead to bias in the implementation of AI. There's also this issue, this notion of transparency and the black box where the predictions are made, and so transparency kind of ties into this, how the data are being used and what data are being used. And how, when and whether AI is being implemented in patient care, I think is another issue that comes up in the context of transparency. The black box predictions, who is responsible for making sure that those are robust and reliable? When we talk about research, we often think of the role of the IRB in protecting, in covering protections of individual subjects. And this begs the question as to whether it's the IRB or whether researchers have a responsibility in ensuring that the black box predictions are as accurate and mitigating biases and other unintended consequences in the deployment of AI. So next, please. So we can apply the ethical principles to AI, and this comes from Gillian from 1994, actually, in an article that he published in BMJ. And so when we think about autonomy, we're thinking about that applying to informed consent and individual decisions to participate in whether their data are being used. It also applies to transparency in the personal data collection and applicability of AI to how it's used. There's beneficence, which we all know what beneficence is, and that's in the context of do good, and should even be a consideration for how harmful things can be and ways to mitigate that. And then we also have non-maleficence, avoiding unintended harm in terms of misinterpreting poorly constructed models. And then justice, which really gets at this idea of fairness and equitability and doing things to minimize existing health disparities and actually lowering them if possible, using AI for the benefits that it does have the potential to have. Next, please. So the WHO has an interesting set of guiding principles, and they highlight some of the things from the ethical principles: autonomy, beneficence, non-maleficence, and justice. But what I like about this is it also encourages fostering responsibility and accountability. And I think that gets us this idea of how AI is deployed, when it's deployed, and who it's deployed for. It also gets at this idea of some of the topics that Dr. Daniel talked about in terms of the upstream investments that need to be made in terms of robust data collection and inclusion of diverse data sets. I think the other thing that's nice about this is it also is touching on this idea that AI should be used to be responsive to human need. So clinical need, public health need, the needs of the community. Next, please. Judith Estrin, who is a CEO and entrepreneur, she's actually runs something called J Labs in Silicon Valley. She's actually proposed that we should look at AI through a human's rights lens. And in that, she poses a number of questions that might help us navigate some of the dilemmas that come up in the context of AI. And I think what's interesting about this is she's really getting at what do we value and how should that be used to guide how we develop and implement AI, again, into the clinical space, the public health space, and even the general consumer space. She's also touching on this idea of governance in terms of who decides, who knows, and who decides who decides. And I think, you know, governance gets at this idea of having appropriate mechanisms in place to have integrity of the data, but it also gets at people who are generally helping to ensure responsible overall implementation of any technology, including AI. Next, please. So in an article I found in Nature Medicine when I was doing some research for this talk, I found this roadmap, and it really gets at this idea of how to take AI from bench to bedside and beyond in terms of thinking about, they frame it in the context of marketing the technology. But what's really nice about this is they go back to this idea of thinking about choosing the right problems. And this kind of touches on what Estrin was getting at, and, you know, thinking about how we are deciding where and when AI is being used. There are times when it may not be appropriate to implement AI in a particular population or at a particular moment in time. There's also this idea of rigorous evaluation and thoughtful reporting of the data. You know, have you really tested everything? Are you being open about the model and the code that are being used? And then, of course, as someone who thinks about ethics a lot, I like this idea of thinking about engaging an ethicist in the development and deployment of any AI model. This roadmap also kind of gets at this idea of data provenance and touches back on the idea of data governance. So I think, you know, this is really kind of wraps it all up nicely in terms of what has been said so far. But at the end of the day, I think there's the question of, you know, what's a person to do who's in research? So next slide, please. So from a report from the National Academy of Medicine that is, I think, nicely titled, appropriately titled, "The Hype, the Hope, the Promise, the Peril of AI." It gets at this idea of some different steps that can be taken for researchers in thinking about how they are developing and implementing AI, in particular in the clinical space. So there's seek out robust evaluations of model performance, utility, vulnerabilities, and bias. Again, that's being responsible for the work that's being done. Be respective of effort should be deliberately allocated to identify, mitigate, and correct biases. So again, going back to this idea of health equity and ensuring that we are minimizing any problems that may arise in the implementation of AI to different populations. And then finally, demand transparency and data collection and algorithmic evaluation processes. So again, this comes to reporting in terms of being open with the code and the data sources and how the model was built. So this all matters. Something that I think about a lot in research ethics is trust. And next, please. So at the end of the day, well, all of what I've said kind of ties into any, not just health equity, but to everyone. I think we have to remember some of the things that different populations have experienced in the context of research. And we need to come back to this idea of trust and being trustworthy so that people actually trust us. And with that, I'll turn it back over to Jen.
Great. Thank you so much, Dr. McCormick, for that very thorough overview of the ethical implications that we really need to employ as we're developing AI tools to advance health equity. So where do we go from here? I'm going to spend the next few moments thinking through these following discussion points. So feel free to raise your hand and we will call on you, or place a comment in the chat. We're going to tackle this first one. What are some hopes for AI and health equity? And you can think about this from your own role in research or healthcare delivery. How can AI impact health equity?
Good morning. I feel like I like to look at it as bringing some data silos together, because I feel like data is kept in so many different places, and if we could bring it together, then we can really have a whole person look on patients, and then I think maybe start that predictive analytics and really preventative care.
That's an excellent perspective. Thank you, Heather. Other thoughts? And please do feel free to utilize the chat. Jess and Paula, if there's any chat comments.
Yep, Jen, there are a couple of comments in the chat, but maybe I'll allow Melanie to go first. I see that her hand is raised.
Hi, yeah, thank you. So I was just thinking about, using AI to predict people at risk for certain outcomes. And some of those outcomes have stigma attached to them. And so, besides the fact that there could be bias in the data that you're using to run the algorithm on, in someone's medical chart, then there's the, what do you do with that? Do you approach the person and how will you handle that? And are we going to end up, because of that bias, approaching people and adding to stigma? And making it more difficult for them to engage with medicine because they feel at risk of being called out and judged for perhaps information that they didn't in that moment share. So I think that's a amazing area, like being able to predict risk of outcomes, and also an area that where we have to tread very, very carefully.
Thank you, Melanie.
Yeah, Jen, I just want to jump in. That's such an excellent comment, because when we think about, like, for example, stigma associated with, you know, substance abuse disorder or mental health, mental health challenges or mental illness and things like that, even today, you know, there are a lot of now regulatory protections around that data and how it's used under HIPAA and in the healthcare setting. But there are still individuals who would, you know, be hesitant to even come forward to say these are the challenges, or you know, that they want to be evaluated, et cetera, because, you know, if you're a physician, like, is this going to go in my record? Is it going to impact my licensure? If you're, you know, law enforcement, like, what are going to be the implications for your career? And oftentimes that's not totally clear. Like, we can't assume that everyone knows, oh, this is not going to be used against you. And so if there are already issues with trust, just in general, you know, AI adds an additional layer because it's not necessarily well understood by the general public, by everyone. So there's like another layer of trust that needs to be overcome in order for there to be a willingness to engage. And I think what was shared in the presentation is that, you know, informed consent, like, it's hard to consent to something you don't trust. And it's hard to be informed if no one has shared with you, like, the full range of implications for engaging with that particular capability, whether it's AI or whether it's just a clinical intervention. And so there's a lot of onus on the deployers and the developers and, you know, quite frankly, clinicians. It's got to be a partnership to make sure that those that are going to be opting in, hopefully, or consenting, if it's, you know, medical research or their clinical interventions, are well informed enough that they feel confident making that decision.
Thank you, Dr. Daniels. This is Melanie again. And you know, something you said made my brain go in a little swirl. And it was, you know, being concerned that you might share something with the police. And I was just imagining how, you know, we have the data that's been put into the EHR, and it's, you know, the lab data, the admittings, you know, all that stuff. The AI is something different. And you know, if that is instituted in that EHR, right? So something maybe comes up when the doctor opens the chart and they see this patient had these parameters, the algorithm ran, and boom, we have something to tell you about this patient. Is that data now something that can be subpoenaed?
Wow.
Yeah, and that's going to go back to the other part of professor's presentation of what are our values, right? And then whose values, who decides, I think it was like who decides, and then who decides. What are our values? You know, and these go beyond healthcare. We're in a capitalistic society, and again, context specific. What are our values? Because that's going to determine the levers that are pulled when we ask that question, that very good question, like, can this be subpoenaed? If the values of the individual that decides who decides are that, yes, all of it is fair game, then, like, wow, you know. If the values are different, then, you know, it's just a really big, it's something that is considered totally outside the vacuum. We have to bring in all of the social, geographical, like, economic considerations to see how we can truly be ethical when applying AI in you know, in healthcare or any other industry.
Amazing.
I think something we haven't talked about is too much is privacy, and someone commented on the benefit of being able to unsilo different databases to benefit individuals. But I think in the context of research, we often think of these data as being de-identified. And once you start unsiloing data sets and bringing them together, the potential for identifying individuals actually increases. And so I think that's, you know, that's something to think about in the context of the research aspect of using AI and big data. And it also gets at this idea, back to this idea of governance and having some type of oversight over how the data are used, when the data are used, and for what purposes the data are used.
Jen, I'll share a couple of additional comments that have been put in the chat, if that's okay. Diane said one of the hopes, so if we're still talking about the hopes, is to reduce workload to allow for more resources to be devoted to reducing disparities, also identifying disparities. Amanda noted that a hope is the ability to create an algorithm to find applicable subjects for research studies. Dr. McCormick shared a couple of things here too. There is the potential with diverse data sets to minimize health disparity. Michelle said, hoping the use of AI in healthcare allows us to more readily serve populations who have been historically underserved, for example, rural or those with mental health disorders. To the point, though, we need to assess data collection and reporting practices to ensure we are improving them to be more equitable, so AI outcomes will also be equitable. Dr. McCormick had a comment there as well related to some of these underserved populations. And she says there is the issue of disparity for small communities, for example, Native American tribes. And then James has a question in the chat, not necessarily a comment, but a question. And I don't know if we can answer this for you, James, but the question is, has Penn State Health begun to implement AI in any of their activities, for example, patient care research or activities in the College of Medicine?
Yeah,
So I don't know. Yeah, go ahead, Jen.
Thanks. Yeah, thank you so much, Paula, for uplifting those comments from the chat. And James, that's an excellent question. So it certainly is prevalent in some of the research that's done at College of Medicine. We have some seed awards already funded to look at different aspects of AI on a wide variety of health conditions. So I'll make sure that that gets shared in the follow-up communications. But any clinicians or healthcare delivery facing folks on the call that might be able to speak to AI implementation in the clinic space, please feel free to update us on what Penn State Health has been doing with AI.
Jen, there's a comment from Abby Fisher who says that this highlights for the even greater need for CHEER's work to engage the community in input and decision-making around how AI is used. This builds trust and moves us toward ethical use of this tool. Thank you, Abby.
Yes, thank you for that comment. For those of you that aren't as familiar, CHEER is really an infrastructure to support community academic partnerships through community engaged research efforts. So this provides, another opportunity for us to really engage with the community on their perspectives as we work with different researchers to implement AI in their work, really making sure that every stage along the way that we're garnering impact, community input to really inform the way the research is set up. We touched on some concerns, the stigmas around AI implementation on various conditions. Any other concerns that come to mind? And then we can switch gears and think about what role you might be able to play in the unfolding of AI, both in your professional role and even your personal life. As we know, AI is going to infiltrate into all aspects of our lives. It already has in many ways.
Jen, there is one additional comment in the chat, and I personally think this is a very important one. Elizabeth says, the issue of the fact that there is no one singular definition of fairness or even of equity. Those are all kind of in some ways left to interpretation, right? Yeah, this is a very important point, I think, Elizabeth. Thank you for your comment.
Yeah, that's a great comment. Again, and it speaks to the context-specific nature of AI, right? Geographically, culturally, you know, you're not gonna get necessarily a uniform definition. I think I was in Nigeria a couple months ago, and we were building out the Nigeria AI strategy, and it wasn't yet sector specific. They had to kind of break out, and I mean, there was just this lengthy discussion. There were a lot of academics there, and I love academia, but like, it was just like, what is responsible AI? What is like, you get locked in because it's so important, and ultimately, we determined that we have to, you know, in that context, focus on what is the Nigerian or the African ethical foundation, and that has to be the basis. So, and similarly, I think, you know, like CEnR is, you know, very community oriented. If there's a requirement that the voice of the community, the voice of the individuals that are ultimately going to be engaged, it has to be at the table upstream at design. And that is not necessarily attractive work for, I think it's probably a little bit easier in academia, but in industry, it's not necessarily as attractive because you're always trying to move fast. Like, we've got to innovate, we've got to move fast. But if we want to do it right and do it well, you have to bring that community voice in at the design phase in a way that is that they can understand. It can't just be jargon and like a lot of technical talk. It has to be actually communicated so that they can help inform what actually gets designed. And that's probably one of the most important pieces. Again, going back to trust, probably going to be one of the most important factors.
Thank you, Dr. Daniel. I think that's such an important emphasis on the context and the infrastructure to even start the conversation of what does it mean to be equitable? Who do we need to invite to the table to engage in equity work? And that will really translate into the design and implementation of how I funnel.
Yeah, I think that it also speaks to the idea of governance, who decides and who decides who decides. So I think governance structures can include community members. And I think that's as important in the development of AI or any technology as the technology itself.
Thank you all so much for engaging in this very thought-provoking and stimulating conversation. I want to make sure we leave a little bit of room for questions and answers, and any that we don't get to today, we'll make sure that we have responses in our follow-up communication. But any Q&A for our wonderful panel today? And I also encourage everyone in the room to just place in the chat something new you learned today. Something that you'll walk away with that might influence how you interface with AI in research or healthcare in the future. Looks like Melanie, you have your hand raised. Please share.
I was just curious about the video that you shared, about AI, and if that's something that's accessible on the internet. There's a link for that we might be able to see.
Yes, for sure. I'll make sure that that is available.
Thank you.
Okay, we just have a few more closing slides here. We have several resources. The literature is very broad and expansive in terms of how AI can both support health equity and also, unfortunately, promote health disparities. So we have a handful here. There's several more, so please do continue to read up. I did want to draw your attention to the last one, which is the AI Fairness Project. For those of you that are actively implementing AI in your research, this is a wonderful resource to check out for equitable algorithms and considerations to make to your data and machine learning models. So something to check out for sure. Again, these are hyperlinked and will be shared with our final communications. We're also going to place in the chat a link to our evaluation. It's a short and sweet opportunity for us to learn how you felt about our session and also what we can offer to make sure we're addressing any knowledge gaps in the future.
Jen, there is one question in the chat, if I may
Please.
pose this to Dr. Daniel and Dr. McCormick. The question comes from Diane. Thank you, Diane. And she's asking, what do you feel would be a possible policy or regulatory path forward to help structure how AI is used or created in the healthcare industry?
Wow, that question requires its own it requires its own session. I don't think I can do it justice. Maybe Dr. McCartney can. I don't think I can do it justice, but wow, such an amazing question. I wish we had more time to dig in because we're still struggling with the definition of AI from a legislative and regulatory perspective and how it actually is defined from an operational perspective. So I don't know, reach out and we could definitely have that conversation.
Diane's follow-up comment is, haha, very late question. Sorry. LOL.
Yeah, I agree with Dr. Daniel. It's a pretty big question. I know it's interesting. I read yesterday, saw a headline that the state of Colorado is going to be implementing a policy that'll have some oversight over AI, and it's probably in the context of employment, but and thinking about biases that we're aware of in the context of the data and the limited data sets. But I think that's a pretty big question. And I think even at the federal level, correct me if I'm wrong, Dr. Daniel, but I think even at the federal level, the FDA is kind of struggling with how to oversee the implementation of AI, at least in the medical context.
Yeah, that's true.
Well, we are right at the hour. I want to thank our distinguished speakers, Dr. Daniel and Dr. McCormick, for your incredible expertise and really helping us on this pathway towards promoting health equity and reducing health disparities and this intersection with AI. So thank you both so much for your time. Thank you to our wonderful engagement from our audience and to the CEnR team for all of their behind the scenes work to make this possible. Have a wonderful rest of your day, everyone.